The United States is approaching 1 million COVID-19 tests a day, but even that pace falls far short of what is needed to quell the pandemic. Efforts to reopen schools and businesses are creating an enormous demand for testing and frequent retesting. There are two basic types of tests that are used to detect COVID-19. A viral test is meant to tell if someone is currently infected. An antibody test gauges whether someone has had a past infection, with or without symptoms. The Food and Drug Administration has authorized 173 test methods. Nationwide testing has ramped up to about 800,000 a day. Even that pace, however, falls well below what experts say is needed to get the pandemic under control.
30 million tests a week, which is what we think America desperately needs to avoid and to avert a catastrophe that's even worse than what we're experiencing now.
Fast and widespread testing is crucial to taming the pandemic. Without fast, widespread, and accurate testing, health officials can't detect and try to isolate enough infected people to stop COVID-19's rapid spread.
In most of America, testing is now taking 5, 7, maybe even 9 or more days, and that renders it basically ineffective at taking those who are positive out of the chain of transmission.
For businesses or schools to safely reopen, their workers and clients must be steadily tested and retested for COVID-19, a challenge the nation cannot yet meet. Besides these millions who must be tested for public safety, many other Americans simply want to know if they have the virus, and thus seek tests even if they lack symptoms or haven't knowingly been exposed to sick people. The combined demand is so great, it's possible that frequent testing solely to help open businesses or schools just isn't feasible. The current state-by-state response lacks national coordination and consistency. Each state is largely left to set its own targets and strategies.
We do know that every country in the world that has got on top of COVID-19 has done it based on a plan that makes testing effective and ubiquitous for their populations, and particularly those in need, and then ties testing and test results to isolation and quarantine efforts that can help reduce the chain of transmission.
Widespread and accurate testing is essential to knowing the number of cases.